Good evening, I'm Dr. Amith Kamath, Consultant Orthopedic Trauma and Robotic Joint Replacement Surgeon from Unique Healthcare Center, Rajajinagar, Bangalore. Today we will discuss a little about osteoarthritis of the knee joint, which is basically a degenerative or wear and tear of the knee joint. Arthritis can affect any joint, and there are many other conditions in which arthritis is there. Osteoarthritis is a primary wear and tear of the joint, wherein we see the cartilage of the joint is broken down due to wear and tear. And here we have some models wherein we will explain, and then I will get to the treatment. Now this is a normal knee joint, wherein the blue area is the cartilage, where you see a normal joint and it functions normally and there is smooth movement of the joint. Now as the patient ages or due to other conditions, there are sometimes a little bit of damage that occurs, and the initial wear that we start to see is on the inner side of the knee, or what we call as the medial joint space, and that is narrowed. All this is visible vaguely on an X-ray, even clearer on an MRI, but MRI is usually not necessary. So once this wear and tear starts, patient might experience pain either when walking or through the day or sometimes even in the night. And at this stage, it is very easily treatable with the help of physiotherapy and painkillers, which is NSH. Now, osteoarthritis as such cannot be stopped. It is a progressive disease. So when the progression occurs, there is further wear and tear of the joint, wherein you will see extra bone growth that starts to occur, as well as degeneration of both the joints, which is in the medial joint space and the lateral joint space. When it comes to this stage or a little between these two stages, what we can give them is, we can give them painkillers, physiotherapy, as well as treatment options such as PRP and hyaluronic acid, which are both in their own ways helping the patient relieve themselves from pain as well as smoothen the joint movement. And after a certain time, this progression occurs to an extent wherein there is severe damage to the joint, wherein there is excessive wear and tear in the cartilage. The patient will experience excruciating pain, especially in the night times, impossible to move around, very difficult for them to tolerate every day. And in such cases, what we can offer them is painkillers to a certain extent, but then if they are resistant to that, then we have an only other option, which is basically knee joint replacement, wherein we change these blue colored area surfaces using metal implants, and in between there is plastic that we use. So this procedure is done in cases of severe arthritis. Also, a third joint in the knee joint is present, which is called the patellofemoral joint, also called the kneecap. When the kneecap is broken down, again leading to bare areas in the cartilage, again the patient experiences pain, usually in the front of the knee, and this knee pain is again treated with joint replacement. Now, if people don't want to undergo joint replacement, we have novel treatments such as platelet-rich plasma therapy, in which we take the patient's blood, it is centrifuged and then given back into the knee joint to have possible regenerative effects. Please contact us for more and schedule an appointment so that we can sit and discuss in detail as to how we can tailor treatment to your needs. Thank you.